we're moving now from the PDE file itself to files that you can link to the PDE if you have the identifiers. One is the prescriber characteristics file. This is from the HIC-IDEA prescriber database. The ID that you would use to link depends on the year of data that you have. And so from 2009 to 2013, there was a CCW prescriber ID. This was assigned by CCW. Starting in 2014, now it's just prescriber ID. And if you were looking, you needed, you had 2013 and 2014, you can get a bridge file that would help you to link those two. The prescriber database has NPPES, which would be what we think, the NPI level data. But there's also information from the DEA administration and SureScripts. You can get information like the specialty of the prescriber from the taxonomy codes, the practice location, state level is I think the finest gradation you get with that. And then there's the academic credential you can also find. The prescriber file links to the PDE 95% of the time. If it doesn't link, that usually means that for some reason, the PDE prescriber ID doesn't correspond to a known format. So it's not an NPI or DEA number, or just that the prescriber ID is not present in the database, in the prescriber database. So 95% is pretty good, but whenever we're trying to merge data, there's always the chance that we're not going to be able to merge everything. But one thing to note is that starting in 2014, the prescriber ID is actually an actual identifier, and it's always NPI. So you are able to link to other databases if you want. The prescriber characteristics file is, something that is handy because it will be, you have linking variables that are already set up for you and it's straightforward, but there's no reason you can't use the NPI even to link to claims data if you wanted to. If you have the prescriber ID from PDE and you want to see, when did this patient see this prescriber as a physician visit. One thing to note, similar to any other time when we're merging, it's sometimes not quite as straightforward as you hope it will be, but we always say when you're working with these data on this scale and just the complexity, really allow time for your research study. Don't assume that, oh, I've got the NPI here and the NPI over there. It's going to be really easy. But there is that possibility. And just note that prior to 2014, you can request the prescriber ID qualifier code so you can find out whether you have an NPI or what you have. So if you do request the prescriber characteristics file, then you have taxonomy codes for the prescribers, so you can get the practice specialty. You can get the values at this website. They are not the same specialty codes that you would find in the Part B file if you're used to working with claims data. That's the CMS specialty code versus these are prescriber specialty codes. And so you should expect to see, a reasonable amount of overlap, but sometimes, someone might register with CMS as a general surgeon, and they're going to look like a more specific surgeon as a prescriber ID or something like that. So just note that if you're trying to compare the two. These are some examples for the prescriber codes that, you get this long taxonomy. Each piece of this has information in it, but you can tell whether it's family medicine or cardiovascular disease. When we looked in 2019, family medicine, general internal medicine, primary care providers are by far, the most common, but you can find cardiology, psychiatry. So you do get information about specialty codes. Gia had a nice article that we can use to look at. So she took, instead of using the prescriber file and linking, she just linked the prescriber ID from the PDE to claims data to try to figure out who was prescribing Sovaldi. She had mentioned that before. It's a high cost drug that was used to treat hepatitis C. So a primary care provider could prescribe it, but might a specialist be more likely to prescribe it given the high costs? And so they found a couple of states that had a different models of promoting Sovaldi prescriptions, and they were able to keep the prescriber ID of the first fill for each drug user. You're going to have to choose one, so you can use the first. And identifying the NPIs of the primary care providers using the physician NPI and provider specialty from the carrier files, because the carrier file does give you the specialty code. And then create the PCP indicator. And they found, with the state that had a primary care promotion model, they found higher use of a higher percentage of drugs prescribed by primary care providers. So something that you're able to do with this data. I looked using the prescriber database, and I just want to show you this might be the kind of thing you would face if you were trying to she mentioned that, you would have to, even in the Part B data, you have to decide, who am I going to count as a primary care provider? This is the type of information you would get from the taxonomy codes. They do have a taxonomy text description, so that's actually what this comes from. And I just looked at prescriber ID on Sovaldi events. And, most of the time it's gastroenterology. You do find infectious disease and hepatology. And, these are the lower bolds are ones that I would consider probably primary care, but then you've got some others that are very general. There's one that's just specialist. There are some that are pharmacist or emergency medical services or allergy, legal medicine. So there's a lot of stuff that you're going to have to sift through and decide how you want to categorize them. But this is what you would get from the prescriber file. So that could be useful to you. The other file that you could request to link to the PDE is pharmacy characteristics. We talked a little bit about this earlier. This is from the NCPDP data queue database. And again, 2 different IDs to link depending on your years, and a bridge file if you need to go from 2013 to 2014. The types of things you can get from this data, you can find out, is it an independent chain, franchise pharmacy, government pharmacy, the dispenser type, retail or community, long-term care, a clinic pharmacy, and you do get a taxonomy code for it as well. And then, you get a parent organization. So they're usually one parent organization could correspond to many different NCPDP IDs. And you also get information on 340B status. So some researchers are very interested in this, that healthcare organizations can get discount pricing on drugs if they're serving people that need extra help, underserved populations. And so about 16% of the pharmacies in 2023 had 340B status. And there's also an indicator code. So it's yes, no, 340B, and then a variable that describes the level. So is it that they serve a totally indigent population, or there's some people that qualify and some that don't? And this can be linked to the PDE file. When we do that, we find that retail and community pharmacies are the most common, as you might expect, and 12.7% were long-term care pharmacies. And also mail order pharmacies are relatively common too. So about 9% of PDE events are from mail order pharmacies. If we were just looking in the pharmacy characteristics file, there aren't that many of them, but they do account for many more events. The types of taxonomy codes again. So is it community, retail, long-term care, mail order? So for the provider and pharmacy characteristics file, if you wanted to request those files and you wanted to link them to the PDE, you would want to be sure to request these identifiers, starting in 2014, prescriber ID and NCPDP ID. And these would link to the PDE, or you might use them to link to external data sources as well.